How can self-guided exposure therapy help with PTSD? Imagine taking small steps to face what once felt overwhelming. Self-guided exposure therapy allows people with post-traumatic stress disorder to do just that by gradually confronting trauma-related memories or situations at their own pace. This process can help reduce feelings of anxiety and avoidance over time. It empowers individuals to actively participate in their healing, which can boost their sense of control and motivation to continue treatment. Exposure therapy, especially a form called prolonged exposure, is a well-supported, evidence-based approach for treating PTSD. It works by helping individuals safely face trauma reminders or cues that trigger distress. When these cues are repeatedly exposed to in a controlled way, their power to provoke fear diminishes. Traditionally, this therapy is guided by a mental health professional, involving repeated sessions where the person confronts memories or situations linked to trauma until the distress lessens. Research shows that this method can lead to significant reductions in PTSD symptoms and can have lasting benefits even years after treatment. Self-guided exposure therapy builds on these principles but allows individuals to manage their exposure outside of therapy sessions. This can include using virtual reality environments or following structured exercises designed to gradually increase exposure. For example, virtual reality exposure therapy has been studied for both social anxiety and PTSD. It helps users slowly get used to feared stimuli, decreasing their physiological arousal and anxiety without becoming overwhelmed. This gradual process supports desensitization, which can improve symptoms and foster a sense of empowerment and control over their recovery. For many people with PTSD, self-guided exposure can serve as a helpful supplement to professional treatment. It offers a way to reinforce what is learned in therapy and continue making progress between sessions. Practicing exposure exercises at home can help maintain gains and build confidence. However, it is important to remember that self-guided approaches are most effective when used alongside guidance from mental health professionals. They can help tailor exposure tasks to individual needs and ensure safety, especially if someone experiences increased distress. Another related approach is written exposure therapy, where individuals write about their traumatic experiences in a structured way. Studies have shown that this method can be just as effective as traditional therapy, often with fewer sessions and lower dropout rates. This suggests that self-directed or minimally guided exposure methods can be valuable parts of PTSD treatment, especially when professional support is available. It is crucial to understand that exposure therapy, whether self-guided or therapist-led, may not be suitable for everyone. Some individuals might find the process distressing or may choose to stop treatment. That is why consulting with a mental health professional is essential to determine the best approach for each person. They can help decide if self-guided exposure is appropriate and how to do it safely. In summary, self-guided exposure therapy helps with PTSD by enabling people to gradually face trauma-related fears in a controlled way. This can reduce avoidance and anxiety, leading to symptom relief. It encourages independence and active participation in recovery, but should always be used with professional guidance to ensure safety and maximize benefits. Remember, everyone's journey with PTSD is unique, and personalized medical advice is key to finding the most effective treatment plan.